I was dehydrated. So yeah, even though things happen that we might think are not going to dehydrate us, we're going to dehydrate. And I told y'all like how much water we're supposed to drink per day. I mean, you know, it's kind of, I mean, think about that. But so yeah, so we're going to get into all of this and find out what's going to happen to it at that level. That little white drawing that they try to have right here, this little squiggly line, where they're trying to represent a nephron. Because we tend to think of this as being what does everything. No. It is going to actually be that. And if something happens to the nephrons, the kidney function is affected.
Now I have a question. Does the blood go through the nephron, or is it the other fluid? Blood goes through the nephron.
Yes. And we'll start talking about that because this is where it gets important, where the filtration will be taking place, and then pressures that can affect it. Because these nephrons, for example, people who have chronic high blood pressure, one of the organs that gets affected is their kidneys. The reason why, if you remember to relate where the kidneys are compared to where the blood comes off the heart by way of the aorta and begins to descend, that's the first organs it hits. So that is tremendous pressure on the kidneys just under normal conditions. If you have someone who has high blood pressure that is chronic, that means the blood coming in is chronically under high blood pressure. And those little nephrons that the blood has to make it to, which are microscopic, I'm going to keep saying that, which are microscopic, can burst. And these are the working unit of the kidney. So therefore, if they burst, guess what? They don't repair. They're gone. That's it. Done. Too much of that happens, you're affecting the entire function of those nephrons and that kidney altogether, i.e., renal insufficiency. Kind of cool, right? Wonderful organ. Love it. You'll never think about your kidney or your bladder or your urethra the same again.
So is it like when you drink a lot of water, and your urine, is your urine supposed to be clear, or is it supposed to be?
Now, people tend to think, okay, well, if I am dehydrated and I've got the particular color of urine that comes with being dehydrated, okay, they think, oh, well, I need to be drinking a bunch of water. They tend to think that's not harmful, when in reality, it can be. It's not a good idea to try to hyperhydrate. So in other words, during a particular activity that you might be doing that might be physical, making you sweat, or whatever the case might be, it's not a good idea when that activity is done to try to drink a whole gallon of water. You may be craving it because your body's going to make you crave it, okay? And you may be craving it, but don't do it, because guess what? The nephrons can burst just like in times of high blood pressure. So if the body is working great and you do give it a high amount of water, not something that's really like outrageously high, the urine will actually become clear. And that's not harmful. It really isn't, okay? As long as your body's getting rid of it, you're okay. But if it ever gets to a point where it's too much or the body can't get rid of it, it'll actually make things worse.
All right. This may not be related, but I'm going to give it a shot anyway.
Go for it.
So, I really love the show, King of the Hill. And they're always talking about having a narrow urethra. So, like, what is that, having a urethra? Like, what does that do to you?
Actually, for us to urinate, which we'll get to, okay, we actually are, okay, so when you look at the structure of the bladder and the urethra, okay, so when babies are born and up to a certain age and that sort of thing, we are training them, right? All right, babies wear their diapers, they wear the little pull-ups, and once they get old enough, we're trying to be like, let's go potty, let's go potty, let's go potty. Because the way of our anatomy, the urethra that will empty the bladder has two sphincters. Does everybody remember sphincter muscles? Okay, we have an internal and an external. The internal sphincter is controlled by smooth muscle, which means there are nerve impulses traveling to an area of the brain. And that's why as the bladder fills, because remember, the bladder itself is transitional epithelium, meaning it can stretch and recoil, okay? So, you know, we go get that 60-ounce drink, all right? And we drink. And you're just going about your business and be like, oh, no, I don't need bathroom. You keep drinking. And a few minutes, you know, a couple minutes later or whatever, it's like, should I try to double back to the bathroom? Or in my case, like if I'm dry, you know, if we're on a trip, okay, you think, never miss an exit. Never miss a rest stop. Always take advantage of it, whether you got the feeling or not. So by the time you got the feeling, chances are you're going to have to go. Okay? And then if a rest stop or an exit is not anywhere near, you're going, Can I put a cork in it? Think about that. Okay. And you keep going. Where's the next exit going to be? Where's the... And you get to the next exit, and by the time you get there, you're like running. All right? And so it's because the two muscles, we have the nerve conduction letting us know the bladder is full, i.e. somebody with beer. Beer's going to fill it up quick. Okay? But the second muscle is skeletal. The one we have trained, i.e. potty training. You are training them to take that muscle and be like, can you hold it? Can you hold it? And sometimes you're like, yeah, for a few more minutes. And then, you know, they're like, okay, I gotta go now. Does it ever get overridden? Sure. Okay, yeah. All right. And then other times you're trying to make sure that that muscle is, all right. You've trained one of them, but the other one's not. And it's completely autonomic nervous system. And if that bladder's full, whoo, it can override the skeletal one, and that can not be pretty.
So, when for the elderly or for even other people, whenever you lose control of that,
Yes.
then it's no longer. You said it is the nerve impulses that actually control it, but it's the skeletal muscle that.
The nerve
With
impulses.
face and
The nerve impulses create what's called a micturition reflex. Micturition is the term for urination. Now, as we get older, the micturition will always be there. In other words, that particular nerve impulse dealing with that smooth muscle, okay? But other muscles, like muscles of the pelvic floor, ever heard about that? Okay, which would be muscles within the pelvic region. They're going to age because they're skeletal. They're going to age just like other muscles do, and they lose that ability to override anything dealing with the micturition reflex. And that's where it's almost like going back to a baby and there's no ability to actually be able to control the flow of the urine. And you end up with like the, you know, and I'm going to tell y'all right now, I'm going to tell you, okay? Especially ladies, not the guys so much, but it is going to hit you. You live long enough, it's going to happen. You probably know people that go, don't make me laugh, don't make me laugh, don't make me laugh, I can't do that, I can't do that, I can't do that. You know, you have to be like, let me go to the bathroom first, then make me laugh. All right? And that's because those muscles get weaker. And unless you do different exercises and so forth to keep them strong, they are going to weaken.
So when you have in a catheter, it takes the relief off of those muscles?
When you put in the catheter is actually taking the relief off of the fluid building up in the bladder, because the catheter supposedly goes far enough up where it like actually can coil in the bladder. And so any fluid that gets formed is coming directly through that tube into the bag. So it's actually taking off the pressure of the bladder itself. Now when
It's like actually doing the opposite of, you know, that's when incontinence does happen if you leave fully it for too long, because your body's not used
yes,
to.
you're not using the muscles
Yes,
to
that's
do
when
that.
it could cause incontinence as opposed to like helping it.
So, right, the muscles won't be doing anything to help control the urine flow. I mean, sure, to be catheterized for a short amount of time is usually okay. But there are people, like, have you seen the commercials for people who have to do the self-catheterization?
No.
Yeah, okay, there are companies out there because, I mean, you know, let's face it, it's not a fun topic to talk about. People don't want, you know, they don't want to realize, oh, well, I've got to wear the special underwear or the diaper or whatever the case might be, okay? People really don't want to talk about that. And so it used to be, okay, well, you had to go to the doctor, you had to get a script, you had to get the catheter from the drugstore, and, you know, and that could be embarrassing for a patient, for a person, okay? And so they have companies now that make the different types of catheters, and people who have to self-catheterize, and it could be lots of reasons as to why they might have to self-catheterize. Maybe it was prostate surgery, or whatever the case might be, okay? They have to do that, and they can order now their catheters, and like from a website on private industry, insurance will still pay for it, blah, 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 and have them shipped to their homes. So yeah, so I mean, it's lots of things that can go wrong with the system.
Too old.
I just can't, I mean, I just,
How
you,
often do you have to take it out? And
it depends. It depends, I think, on the issue, if they have to do it for every time they need to urinate, or if it's something they do several times per day. I think it's really just dependent, because,
Comfort thing, like you feel uncomfortable.
and they make them where they're one-time use, and then they make them where they're used several times. So I guess
We do it in the hospital. We don't, our unit doesn't like to use comfortable things at all. Infection risk. So we
Yes,
straight
it
catheter, which
does.
is just like an in-home
in-home
catheter, go
catheter,
in and out.
in and out.
Yeah, drain into that.
And I'm sure in the hospital setting, it's just the one-time use of them.
Well, we bladder scan to see if they're retaining, and then we go in and out.
But what I mean is, they only use that catheter
Oh, yeah,
one
it's a sterile,
time.
it's a sterile.
Right,
procedure,
but people who have them sent to their homes, they can be multiple use. Yeah, but I'm thinking too, it would be a huge infection risk. Yeah. So, but that's okay, because we just covered the ending of the chapter.
When I went to clinicals,
Mm-hmm.
like we had to like write the papers and stuff. We didn't have to like when they got to that system, we would have to say like if they were cotton.
Incontinent, whether they can go on their own or not go.
Or like get someone to assist them to go to the bathroom.
Yeah, yeah. And I mean, you know, and unfortunately with the elderly, that is a big